watching The Source on CNN Philippines. Our guest today, former Health Secretary and Iloilo Representative Janette Garin. So good morning, Congresswoman. Thank you for joining us today.
Good morning, Ria. Thank you for inviting me.
All right, let's talk about the vaccine rollout, specifically the rollout for minors. From 8 hospitals, the government now plans to add 13 other hospitals to join in the vaccinating of minors. But you're questioning this decision and you're asking why it's being conducted in hospitals. Tell us more about that.
2 things, Ria. First, the hospital, as we have known, is one of the major petri dishes of COVID transmission. Ibig sabihin, dun maraming nagkakahawaan. Kasi yung may sakit, magpapakonsulta. Yung may nararamdaman, hindi niya pa alam na COVID, dun magpapakonsulta. So I really don't see the logic why we have to unnecessarily expose our teenagers, especially those with comorbidities, in a hospital setting. Added to that, I believe the structure of a hospital is somehow enclosed. Wala naman sila mga gymnasiums or open spaces where flow of air is very crucial to vaccination at this time of the pandemic. Second, this will overload our already loaded hospitals. And if we keep on saying, let us vaccinate aggressively, bilisan natin, damihan natin, how can we do it if we are restricting vaccination in a few hospitals? Kasi ang plano, we've started with 8 hospitals. They'll be adding, I thought initially it was 7. Now I'm hearing from you it's 13. But after that, wala maghihintay. And it's good to announce this. But in reality, what's happening on the grounds is kapag hindi mo muna maubos ang maraming senior citizens, hindi mababakunahan ang mga bata. But we also have the problem. Some of the senior citizens are saying, hindi naman kami lumalabas. So if we keep on waiting and waiting and waiting, the detriment at the end of the day is still on us. Now we have reducing, bumababa ang kaso ng COVID. What does this mean? It means that we also have lower naturally circulating antibodies. And it's the best time to aggressively vaccinate. Madadarating yung December. You need at least 2 months for vaccine-induced antibody protection. So pag magbabakuna ka next year or sa katapusan na ng taon, it defeats the purpose because expectedly our people will have to go out by December. That's human nature.
Right. So you are against this vaccination in hospitals. For you, Congressman, where is the best place to vaccinate minors?
We have existing vaccination centers. Patients with HIV have been vaccinated there. Senior citizens of comorbidities, mga diabetic din, may heart diseases, even dialysis patients are being vaccinated in our vaccination centers. And if we talk about adverse effects following immunization, it does not happen with the allergies. Some of the immediate allergies will happen in like a few minutes. But some of it, the acceptable adverse effects is expected to happen in the next 5 to 14 days. No, kasi ang observation mo is usually 2 weeks. So if you put them in a hospital, let them stay for like how many, 30 minutes, an hour, they will just be exposed to a lot of pathogens. But I don't think the benefits outweighs the risks. Well, we put them in vaccination centers where expectedly clinically well people are going there for their jobs. Then it's a different thing. And we're also setting a bad precedence for healthcare workers and our vaccinators. Paano kung kunyari may teenager na may sakit sa puso, nagpabakuna ng flu sa health center. At ngayon kung may nangyari, not related to the vaccine, but because the teenager has a pre-existing clinical condition, they can say, hindi, kasi hindi sa ospital na bakunahan eh. We are changing the dictum that hospitals are for curative care and health centers and vaccination centers and clinics are for preventive and promotive healthcare, where vaccination actually falls.
Right. Now, the second phase of vaccination of minors, I think the aim is to inoculate more than 144,000 kids. That's according to DILG spokesperson Jonathan Malaya. How much or how important is it to fast track the vaccination of minors, especially, so many of them just want to go back to school?
I really can't see the logic why we are limiting it to NCR alone. Tingnan mo nung nauna, nilimit sa NCR yung pagbabakuna. And look at what's happening to our provinces. Nagdadala rin ng COVID papunta ng Manila at doon din sa mga probinsya. Marami ang namamatay at maraming nagkakasakit. And we're also seeing a lot of breakthrough infections. Now, in the President's message last night, Secretary Galvez said, dati ang problema ay supply. Ngayon, hindi na problema ang supply. Ang problema namin is how to administer. So with that problem, why are we limiting jabbing or vaccination in certain hospitals? Why don't we put it out in public vaccination centers? Because that has been the usual. I can't even think. I mean, I'm not sure, but I believe we are the only country vaccinating our teens in hospitals. Because vaccination is supposed to be outside. It's part of, parang siyang it's part of, it's like prenatal, that you can go to a clinic, but you can also go to the health center. It decongest the hospital. Moreover, Ria, I'm just a little bit confused because when I saw the press statement of the Department of Health last Friday, it said approximately 92 million vaccines have arrived in our country. But last night, the president said it was already 191 million. But if you look at the total Filipinos, the total jobs or the total number of doses consumed, it's somewhere around 52.7 million. In the reports, we were told that around 13 million has already been prepositioned. So kung titingnan mo, if we focus at the 90 million plus, we have 26 million doses just lying idle. No? Nagre-relax, nag-aaral-ar yung ating mga bakuna sa ating mga warehouse. But if we look at the President's data that was 190 million, ang dami-dami. No? So I am not sure. I thank you for that. No? We can see in the screen the number of doses consumed. So nasaan yung hindi nagagamit? Bakit nagiging mabagal? Because in the provinces, in Visayas and in Mindanao, although it's being announced here that everybody has to be vaccinated, meron kasi siyang mga verbal orders. No? Sasabihin na, ay hindi pa pwede kasi kailangan ubusin mo muna yung 50% ng seniors. Ay hindi pa pwede kasi dapat mauna muna yung mga A3. But the problem is, minsan yung ibang ayaw at hihintayin mo sila, kawawa naman ito naghihintay. No? We go back. No? Who are the sources of infection? And mind you, the clinical trials are showing a very good immunogenicity among children. Sa ngayon nga makikita natin, the younger population, almost always, mas konti yung kanilang breakthrough infections. So if we keep on vaccinating the young, because ganun naman talagang bakuna, mas mabisyak siya kung mas bata na binibigay, then maybe the third function of the vaccine, which is to prevent transmission, can happen in this case. No? Kasi sa mga may edad, just like me, I had a breakthrough infection simply because there's waning protection and there's inadequate protection from the primary series. So we don't know no, if we vaccinate because other countries are already doing this.
That's right.
I do not understand why we always have to deviate from the current practice.
All right, we still have lots to talk about. We'll certainly talk about boosters, but for now, we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, former Health Secretary and Iloilo Representative Janette Garin. Ma'am, welcome back to the show. Just continuing our conversation, you started talking about the booster doses, right? So there's no approval yet from the DOH. In your view, should the government give the third dose already, even at least to priority groups and healthcare workers? Because the healthcare workers, most of them got vaccinated 5-6 months ago. And if the studies of waning efficacy are to be believed, it's time for them to get a booster, no?
Definitely yes. No, I've been very vocal about it before IATF and the Department of Health. In fact, all throughout the pre-plenary and the plenary budget deliberations, this was part of the core questions I was giving to them. Ang hindi ko nga naiintindihan, bakit hindi pa rin natin inaamin na may waning immunity 5 to 6 months after, where it has already been shown by clinical trials, and even the manufacturers are admitting this. Second, inadequate protection from the primary series, ibig sabihin, nung ginawa yung bakuna, this was based on the original COVID virus. Apparently, with the mutants and the variants of concern, nakitaan na yung 2 dose ay hindi niya naaabot yung dapat na protection. So you call that inadequate protection. So you need a 3rd dose. For the waning immunity, you need a booster dose. Okay, wag natin bigyan lahat, pero dapat bigyan na agad-agad ang ating healthcare workers, senior citizens, and people with comorbidities.
So this has then become an issue over who do we vaccinate first? Do we give the boosters to the healthcare workers and the seniors, or do we give the minors first? How do those factors come into play?
If you look at the healthcare workers, it's roughly more than 1 million. No? So you need 2 million doses for that. And kung titingnan nga natin, ang daming nakatambak, no, na nasa bodega lamang po. Now, if you look at the senior citizens, that's roughly around 5 million. Kasi initially it was 7 million, pero iba naman hindi nagpabakuna. So if you take out 7 million from the 30 million unaccounted vaccines, then you still have enough for our teenagers. So we can actually do both. But if you look at the basic situation, o ngayon, sabihin na natin, they're only allowing 12 to 17 years old with comorbidities and selected comorbidities. It excludes people with asthma. It excludes people with who are constantly exposed. No? Kung titingnan po natin, kayang-kaya talaga. Because let us go back. How many vaccines have arrived? How many vaccines has been utilized? How many vaccines have been prepositioned? The only problem is that we keep on insisting to wait for a certain group of people to finish its vaccination process. So that's at the detriment of those who are wanting a vaccination. In addition to that, Ria, ilang beses po kasi paulit-ulit po na ang sinasagot sa akin ng DOH at IATF, 290 plus lang ang breakthrough infections per record of FDA. That is not true. Because in a few hospitals that I'm going, bawat ospital meron ng 200 cases. Yung isang ospital with 100 employees had around 34 breakthrough infections. So, and we need to fast track the 3rd doses for healthcare workers. Why? Kasi kung mahawa sila, patuloy rin silang nakakapanghawa. So we need to intercept the transmission at the very core of the pandemic. And that is hospital transmission, people dealing with patients.
Yeah, that's right. The situation is pretty urgent, and it seems that we have this window in time, where we can prevent something really, really unpleasant happening and another surge. All
yes,
right.
Ria, we are at war. When we are still at war, so we have to act with urgency. The mere fact that we are vaccinating teenagers in hospital settings in a very limited number and only in Metro Manila just shows that we don't have the urgency. Habang ando doon, natutulog, nakahiga, nag-R&R yung mga bakuna, heto naman tayo, padahan-dahan pa konti-konti. It's as if we are not realizing that speed is very vital and crucial in this pandemic.
Indeed, it is. Thank you so much for your time this morning, Congresswoman Janette Garin. And thank you for joining us here on The Source. I'm Ria Tanwat Cotrillo, and you're watching CNN Philippines.